Well, folks, thank you so much again for tuning in to Compass One Connections. We are glad you are here, and we've got a great podcast in store for you today. We're bringing back one of our original guests. In fact, he was the second guest we ever had on Compass One Connections, Mr. Dusty Deringer. He's the Vice President of Patient Experience for Compass One Healthcare. And Dusty, we are so glad you agreed to come back. We figured we might not get you back after the last hot seat.
Well, thanks, Tommy. Like I said, I have a face for radio, so I probably did a little bit better job the first time than I will this time, but we'll see how it goes.
You'll do great. You did great last time. We're glad to have you back. Dusty, let's talk first and foremost, just this past year. I mean, wow, this is unprecedented. Everybody that's had to deal with the COVID pandemic, but you guys especially are with so many patients in the hospitals. Just talk to me on a big, broad stroke, and we'll dig down more into it. But how has that affected the patient experience overall?
Yeah, I know. I think it's certainly a timely question. You know, we patients just in general have had a difficult time. You know, I mean, from the fact that you've got loved ones who aren't able to see their patients, their family members who are in hospital. You've got unfortunately, a lot of patients were in really bad shape. And didn't have the opportunity to see their loved ones in the last, moments or the last few days of their lives. It's been draining, and then certainly not only on the staff, here at Compass One Healthcare, but on the nursing staff as well. The level of burnout, the level of sacrifice, frankly, that the healthcare community has given over the last 12, 14 months has been enormous. And it's, we've certainly seen that on the support services side. I think we're continuing to see that on the nursing side. I read an article the other day, Tommy, from the Washington Post that said that, something like 30% of people who work in healthcare are thinking about exiting the industry. Wow. That is, certainly, I think, sped up because of what's going on or what has gone on with the pandemic. So it's a stressful time. No
doubt about it. Let's break it down a little more now. Let's talk about the perception of cleanliness in the hospitals. I mean, everybody, obviously, if you're just the average person on the street and you think, oh, I got to go to the hospital, the first thing you think about right now is it safe from a cleanliness standpoint? Talk to me about the challenges you guys have faced with that.
Yeah, perception of cleanliness is a big concern right now in hospitals, and for good reason. We've always been focused. I actually just had the opportunity to spend some time with Rich Fezco. We've always been focused on the reduction of HAIs and making sure that the healing environment was clean and sanitized, and it's what we've done since the company began. But the perception it has shifted a little bit. So. We've done a lot of research with Prescani over the last few years, and some of it showed us what I would like to, I call kind of the hierarchy of needs with regard to room cleanliness. The environment has to be 100% clean. There's got to be a confidence of clean from our patients and the caregivers that we work with, and then courtesy really is kind of the top piece really that allows patients to remember their housekeeping. The cleanliness of the environment and their housekeeper when they get a survey in the mail. But what we've seen through some research we've done just recently with Prescani is that perception started to change a little bit. Less about what happens inside the patient room, more about what happens really in the public areas. And then also there's this perception of, that the room is as clean as I feel, as opposed to I perceive it to be. And so can be an issue for Crothall, for Compass One, because we clean rooms, we don't clean people. And so we were doing some work with some personal hygiene kits and some things to help try to get in front of the perception. But it certainly is changing, and thankfully we're able to stay in front of that a little bit.
Yeah, no doubt. That's a challenge, a nonstop challenge, I'm sure, especially during today's day and age. Let's flip over a little bit to the food and nutrition side of the coin here. And, so much of the interaction that the patients get with this foods that comes into their room, and the smiles and taking the orders and all that stuff, and that's changed drastically. Talk to me a little bit about that and what you're seeing on the back end of that as far as results when it comes to patient satisfaction.
We have had a limited amount of access in many hospitals because of the COVID pandemic, and for good reason. Hospital administrators have made decisions to limit how many people are in and out of rooms, especially floors, COVID floors. And what's happened is, in many cases, is we've gone back to the nurses delivering food to patients on those units. And there's a number of reasons, but we have seen a decline in scores in food nutrition services nationally since the COVID outbreak began. And some of that can be contributed to the fact that if we just like I said with regard to the hierarchy of needs in room cleanliness, we know that there's a hierarchy of needs, timeliness, temperature, accuracy, courtesy, with regard to food nutrition as well in hospitals. And if we're not able to deliver those trays in a timely manner, then they're going to be cold. We're going to have issues with temperature, and that's going to impact overall food quality and satisfaction. We've seen that, and that's a result of our teams not really having the access we did to be able to go in as the pro, have as what Chef Neff says, the voila moment, be able to describe what we're having for that meal, and to be able to get feedback. So it's been a struggle. It's starting to slowly come back. But the access to those patients it's been a roadblock for us.
Very interesting. So you've touched on the personal hygiene kits on the EVS side. How else are you guys adapting to just kind of stay in front of this as much as you can right now?
Yeah, so I'll start with since we left off with food, I'll start with food. One of the things that we have done is we've worked with Press Ganey to develop some talking points, some education for nurses and for administrators regarding how important it is for our professionals to be able to deliver the food to patients, as opposed to putting that on the shoulder of the nursing staff. I just spoke about 30% or something of nurses are thinking about exiting, or healthcare workers are thinking about exiting the industry. You've got a shortage of patient care assistants or nurse techs as well. And so the nurses are doing more and more, and they're stressed out, and they have gone through this pandemic. And so, we're helping to try to educate them about the importance of timely delivery of the food. And I'll say the power of food, because we know that there's a power in food, right? So that's really what we've done on the food side. And on the EVS side, I mentioned the hygiene kits. We have developed a cleanliness campaign really that is trying to get in front of this new perception of cleanliness in these public areas. So, we worked on marketing in public areas with QR codes. So patients can scan those QR codes and see how that area has been cleaned. We're doing that in the patient room as well with tent cards and these little personal hygiene kits that we've been able to pilot. That pilot is ongoing, and we're already seeing some pretty good results after a few weeks. So that's kind of the focus that we've had and how we've been able to stay in front of it. The other thing is with rounding, we've been able to, because we didn't have access, we have been able to start calling into patient rooms. It's not something we've ever done before. And we had a few of our patient experience managers try that. It worked really well. We put out a white paper early in the pandemic, and that became a focus of ours as an organization. And we know, since some of those efforts were in place, we took a hit, just like the country did, both in environmental services and food nutrition services scores. But we didn't take the kind of hit other organizations did, because we were able to do some of this rounding, if you will, by calling into the patient room, which is something I think as we move away from the pandemic, it will continue to be a best practice in those rooms where we have limited access.
Is there a silver lining with all this? The COVID pandemic obviously has been horrible, but have you guys seen anything where you say to yourselves, this actually works better doing it this way, that we can do it in the future going forward? Or is it more like, hey, as soon as this pandemic's over, we're going right back to the way we were? How do you see that?
Well, I think we've learned a couple of things. Number one, it has, three things. So number one, it's clarified, I think for all of us, that the relationship that we have with our nursing colleagues is paramount, right? And so number one, we have to make sure that we're operating as a community, that we're really in sync, in lockstep with regard to how we're approaching our patient satisfaction, or just, our daily duties. So that would be number one. just that cohesive environment that we create. Number two, I think, is the rounding I just talked about. I mean, in some cases, we go round in person, and that patient is asleep or they're away for a test. And physically, sometimes it's difficult to get back up there. And it gives us an opportunity now to know that if we call in, frankly, some of the patient satisfaction data is even better than if we visited in person. And so I think that will be a takeaway that we have, as well. And then just generally, I'm really proud of our patient experience managers across the country. I mean, I probably in my career have never been more proud of a group of people I've worked with in my career, maybe even in my life. They pivoted very quickly to be able to say, hey, look, we're going to put our patient experience hats down, if you will. We're going to pick up our operations hat. And so right. They picked up, mops. They worked on tray lines. It was all hands on deck. And we were able to, I think, toggle and pivot into those roles very quickly. And I think, frankly, they learned a lot working with the operators shoulder to shoulder. And I, so from a relationship standpoint, I think it's going to be better moving forward. But also from just an acknowledgement of what our operators go through every day, that's been a big critical component for us, I think. And so I don't ever want this to happen again. But if I were to say, I could take 3 or 4 things away, those certainly are the things that stand out to me.
Yeah, good. Great stuff to hear. What's the next big thing in patient experience? I know you've talked about in the past some experience mapping. Let's talk a little more about that.
Yeah, so about 2.5 years ago now, we started flirting with this idea, really, of mapping the patient journey, kind of a soup to nuts approach, if you will, from beginning to end, from the time the patient is admitted to the hospital to the time the patient leaves. We did it initially to try to understand the touch points that our support services personnel have with those patients. We've mapped a day in the life of a nurse, and we worked with the American Nurses Association in doing that to try to understand the touch points that our support services personnel have with nursing as well. But what we've been able to do is come away with a very comprehensive look at what a patient sees and encounters from an opportunity standpoint, and also from a success standpoint in hospitals when they go into the hospital. We've been able to do that at a number of organizations across the country, and frankly, it's outside really of food, nutrition, and environmental services and patient transportation. It provides the hospital a glimpse of what a patient really goes through. Okay. I think it's made a big difference in the organizations in which we've done it. And I think that is something that, we're going to continue to focus on, certainly with our clients, and excited about what that brings.
Dusty, I have to tell you, and I know you hear this from all your people, and you said about your patient experience managers out in the field, but what everybody's had to go through this past 1.5 years in healthcare, but especially you guys with taking care of the patients in the ways that you do and making sure that no matter what, they still have a positive, good experience when they're in our hospitals. You and your team have done just a fantastic job all the way across the board. You should be very proud of yourself and the team. So thank you for all the work you guys have done with that.
Like I said, I wake up every day thankful for the people that I work with, and I wish I could tell 5 or 6 stories because there's just so much that the team has done, and it's not just patient experience. Our operators have been on the front lines, and it warms my heart. I appreciate that. It warms my heart to be able to work with a group of. I mean, these people are heroes, and yeah. So
no doubt about it. Well, I'll tell you what, if you got 5 or 6 stories, that means you have to come back for your 3rd installment of Compass One Connections down the road. But before I let you go today, last time we put you on the Compass One Connections hot seat, I'm going to do it again today, and I've got some questions so we can even dig a little deeper into the life of Dusty Deringer, the man, the myth, the legend. So I'm going to put a minute on the clock, Dusty. We're going to have some fun. Are you ready?
I am.
All right, here we go. First question for you: favorite comedian of all time?
Oh my goodness. Favorite comedian, man, that's a good question. I'm a big Bert Kreischer fan currently. So that's where I'm going with Bert Kreischer.
Okay. Favorite rock or band of all time? Favorite band of all time?
That's easy. Live from York, Pennsylvania. I'm a 90s guy. So Live.
Chocolate or vanilla?
Chocolate.
Do you like roller coasters?
I like the concept of roller coasters. I like roller coasters, but they scare the crap out of me. So yeah, I guess the answer is yes.
Would you go on one today?
Yeah, it depends who I'm going with, but yeah, absolutely. Yeah.
If you could have dinner with two people, alive or dead, who would they be? Who would you have dinner with?
Wow. Alive or dead? My mom would be one of those people, and probably the Dalai Lama. I think having dinner with the Dalai Lama would be a very interesting time.
I would have to agree with you for sure, no doubt about it. And you heard the ringer go off, so you were officially off the Compass Point Connections hot seat.
Thankfully, thank you.
You survived. But thank you again so much for your time today, Dusty, and thanks for all the information. I know everybody out there is really happy to hear about the patient experience that you guys have kept it up to a high standard level as far as going through this COVID pandemic. And I know once we're on the other side of it, it'll just even continue to go up. So thank you so much for everything you do for us.
Thanks for having us back on, and again, thanks to the whole company for what you've been able to do over the last several months. So thanks, Tommy.
You got it.